So Brenda, so I can see here, after we've kind of looked at your evaluation, and I'll have some of the paperwork here for you, we're going to go ahead and kind of talk about what's going on, okay? So I know that you'd kind of stated that, you get some numbness and tingling into, your palms, especially when, like, you're writing at a computer, which that seems to be pretty prevalent in what you do, and then also, sometimes when you're sleeping. I know, it's not very debilitating, but sometimes what can happen is I made a nice little handout here for you and understanding kind of what the condition is, okay? The condition is a very, very fancy name. Don't worry about it. So it's called double crush syndrome. So it's bilateral carpal tunnel symptoms with cervical stiffness. And I also note that here you also have migraines, which is ironic, but you have some migraines that you do take some medication for that usually give you relief. So what can happen with this numbness and tingling that goes down into your hand with this acute kind of neck pain? So with poor posture, especially if you're sitting at a desk writing your notes, which is kind of how your symptoms came on, if we kind of have this rounded shoulder and this forward neck posture, you can kind of get some compression of certain muscles and muscles and nerves that go down from your cervical spine that go all the way down into your whole body, right? But for the most part, it will really just affect your upper neck that goes down into your shoulders and then down into your arms. So that's why you might be having that numbness and tingling down the middle of your hand, okay? And one of the things that we can do is we want to get that nerve to actually move within the sheath. So a nerve is kind of connected. Each nerve is connected, but it's wrapped around the sheath. And when that nerve kind of becomes compressed, you can get kind of like little adhesions in it, okay? And what we want to do is to get that nerve to move correctly through the sheath so that you're not getting the interrupt connection that will cause that numbness and tingling down your hand, okay? So the very first thing that we're going to do is we're going to do what's called a median nerve glide. On this sheet of paper, you'll also see you can access all this information. So if you have any questions, you can go online and it will show you a video of how to do it as well, okay? But what we're gonna do is I'm gonna go ahead and kind of stand in front of you and we're gonna go ahead and do the median nerve. So what I want you to do is you're gonna sit up nice and straight, perfect, and I'm gonna do it kind of in front. Actually, I'll just do it seated with you. All right, so we'll focus on the right arm first, okay? So you're gonna go ahead and put your arm up like this, like you're doing almost like a goalpost, okay? And then you're gonna straighten out your arm, okay? And then keeping your hand, you're gonna extend down, and then you're gonna go ahead and turn your ear towards your side, okay? All right, and then you're gonna come back up and make kind of like you're gonna show your bicep, and then put your ear, your opposite ear, to the opposite side. So what this is doing here, okay, we're gonna kind of incorporate both of those movements. Good, extend that wrist, and then come on back, all right? Are you getting any numbness or tingling? And if you are, that's okay. If you're not, that's all right too. No? All right, so you're gonna continue to do this. And while you do this, I'm just gonna explain it to you, all right? So the nerve starts at your neck and it comes down, okay? So when you go ahead and you compress, right, in this motion, right, you're compressing right here through your neck, but you're lengthening the nerve as you extend. Then the opposite is you're compressing the nerve this way. Go ahead and come on back. Right, you're gonna be compressing this area and elongating this area. Does that make sense? And then do it one more time. Compression, extension. Does that make sense of the nerve? Go ahead and relax. Okay, so with that median nerve glide, people ask how many times can I do this? What should I do? One thing that you definitely want to do while you're doing it is making sure that you don't elevate the shoulder, okay? If you start to elevate the shoulder, make sure you kind of relax it down. And if you go through it a couple times and you notice like you're elevating, then I want you to go ahead and stop doing that exercise, okay? So, as we do these nerve glides, you can get a relief of symptoms, and then you can actually continue to do strengthening of certain muscles, and then also kind of some releasing of tension in the anterior aspect of your shoulders. So a lot of the times, like we said, when we go back to kind of that bilateral compartment syndrome, the forward neck, one exercise that we can do for that is doing like a cervical retraction. So you want to go ahead and retract your neck back. So it's called a chin tuck, okay? So here, right, we know we're kind of a forward shoulder when we're typing like this, and then actually getting those shoulders, tucking that chin back, holding for about 5 seconds, and then relaxing and squeezing. Now, if that caused some kind of pain to radiate kind of up into your head, that's common. Don't worry about that. The next time that I see you, if it's continues to get worse, let me know. But sometimes that will happen at first, and then as the more you do it, it goes away. Okay. You can also do that laying down in a position where you're just laying down on a. And again, they have I have these in here for you on all these little exercises. So you have the seated one, and then also laying down. Okay. And it tells you how many reps and how many sets that I want you to do per day. Okay. And then on top of that, right, we need to kind of stretch all these out. So sometimes you'll get those kind of cervical headaches, okay, those migraines like you say, because you'll have this upper trap muscle, which actually inserts at the base of your skull, okay, will get really tight and cause some kind of pressure points, okay. So doing some nice stretching of those muscles, which would be relaxing your hand, kind of holding onto a chair, and then bringing your head across this way, and then also down this way. And you might feel some pulling in this region. Again, totally normal. You can always use your other arm to bring it up above you to apply some more pressure. Good. All right, and again, these exercises are on here for you for your reference. And then we talked about also that posture of being at the computer. All right, we really want to try to, we talked about that forward shoulder. So we have tightness of these muscles and weakness of our posterior muscles, okay? So one thing we can do are called scapular retractions, really, really simple. You're just gonna go ahead, try to bring those shoulders down and back and squeeze and hold for about 5 seconds and relax. And then come on forward again, squeeze in the back and relax. Good. Do that one more time. Good, good, good. And one thing you might notice, right, I want you to try to squeeze kind of in between your your shoulder blades. If you're squeezing up top, up in here, and hey, maybe we're doing that one a little wrong. We want you just to squeeze a little bit lower, okay? And you know what causes this neck pain? We kind of talked about sleeping. So sometimes you can sleep with a roll up a towel roll and put it right underneath your neck. Sometimes we'll sleep in this kind of flex position, which can kind of compromise that nerve entrapment that you might be experiencing. Okay, like you can see right here is healthy sleeping position with this towel roll, and then also that desk posture when you are typing notes and things like that. That we're not forward shoulder looking forward. We're kind of bringing our shoulders down and back, tucking that chin back, and typing with good posture. Okay. If you do have any questions or anything like that, feel free, of course, always to give me a call or to email me. But I do have, you log on here, this is your access code, and you'll be able to access kind of all this information that we just went through with, with that median nerve glide. All right, as our dog's just playing in the background.
I know, you